I'd like to introduce today's speaker, Molly Walt. Miss Walt is the CEO for Nevada Rural Counties RSVP, and she joined the organization in December of 2020. She's responsible for the overall strategic, fiscal, government, and community relations and operational responsibility of the RSVP organization, and she's here to tell us about their RSVP transportation services. So I'm going to turn it over to Molly.
Well, thank you. Thank you for having me this morning, and thank you for everyone who is attending. Yes, I am CEO of Nevada Rural Counties RSVP program, Retired Senior Volunteer Program. We do receive AmeriCorps funding for the Retired Senior Volunteer Program. And with me, I also have our program director, Melissa Connors, who will be here to assist me on information that I may have missed, or during the questions that she'll be able to help with questions as well. So RSVP, our mission is to provide life savings volunteer programs to help seniors and adults with disabilities maintain their independence with dignity throughout the 15 rural counties in the state of Nevada. Who are we? We are a nonprofit 501c3 corporation. We are in our 52nd year being established. We do service all 17 counties. However, only 2 of them, Washoe and Clark, we service them with virtual programs. Other than the 15 rurals, we do try to offer all of our 11 different programs that we have. We have volunteers, we have independent contractors. We are 86% grant funded. We receive a federal grant, and then we receive multiple state grants through our Aging and Disability Division of the state of Nevada, and through funding of Healthy Nevadas, and through, you'll hear NDOT, which is Nevada Department of Transportation. We have matching funds that we have to fundraise for, and then we do annual, quarterly reports for all of those grants as well. So I'm going to go into our transportation program. So our transportation program is our largest program that we operate right now. Our transportation program is two-facet. We have our fleet vehicles, and then we have our volunteers who use their personal vehicles. Our transportation program is a free escorted door-to-door program. That means we ask our volunteers to drive up to the home of the senior or the adult with a disability, and then we ask them to escort them out, meaning that they are able to assist them, with their walker, help them down the front step if they have one, and get them into the car. We do ask that the assistance isn't much more than elbow to wrist. However, I do know some of our volunteers assist a little bit more than that. We also do paratransit. All of our drivers are required to do the PASS training, which is passenger assistance, security and safety and sensitivity. I'm sorry. That is the PASS training that we offer to all of our drivers in hopes that they will. We have a fleet of 17 vehicles, and 13 of those are paratransit vehicles. When we are providing the transportation in our fleet, those drivers are 100% volunteerism. We do have our Home Companion Good Neighbor program. Our home companions, we ask that they drive their personal vehicle, and then they do get a mileage reimbursement, which is also funded by our state grant on that one as well. Our drivers then, who are home companions, don't necessarily just transport. They do then visit with our clients on different occasions. They will make the phone calls, ensuring that our clients are doing okay. We do ask that they make those phone calls once a week and make a visit once a week as well. The history of our transportation program started in 1980, where the Carson City Rotary donated our first vehicle. In Carson City is where our hub office is, and then we have field offices throughout the state of Nevada. In 1999 is when we received our first Nevada Department of Transportation vehicle. Since then, as I'll explain later, we have received quite a few after that as well. 2017, Carson City Toyota donated a vehicle. And then in 2019, ADSD is when we started receiving, to my knowledge, my history of operating grants that help us with our transportation program, which is funding for gas, fuel, and insurance. And then presently, to 2019 to present, we aggressively seek several different grants from NDOT, the cities, the counties, and the state as well, which has allowed us to increase our fleet to 17. And by the end of this year, going into next year, it looks as though we will be able to increase our fleet up to 23. This is just a few pictures of what our fleet looks like. We have what Ford Transits, which have the back lift. Many of our drivers prefer this vehicle because it is an electronical lift from the back. This is a hybrid that we have in one of our most rural counties. Then we have our Dodge Caravans that have the ramp off to the side. And then this is limited because then we can only seat 3 people in the back, because in the middle is where the wheelchair would go, and then a passenger up in the front passenger side. So we have Dodge Caravans, and then this is a picture of our Chrysler Voyager. We do receive donations through communities as well. And this one I wanted to throw in because most of you know that Nevada is known for mining. And when one of our vehicles was totaled in an accident, not at our fault, the mining in White Pine County jumped right in and we were able to get this donation the next day. So our transportation in White Pine County didn't miss a beat because of this donation from the mining company. We do have some vehicles that are non-paratransit, and this is an example. We have our Toyota Prius here in Carson City. This was from another grant as well. And Dodge Caravan in another county as well. So what is the impact? The impact of our transportation program is really, we are used and we get numerous referrals for our rural seniors living in rural communities to access essential services. Rural Nevada does not have a lot of specialty doctors that in their communities. So we are asked to transport our seniors and adults with disabilities to more urban areas to access medical appointments, grocery shoppings. Many of our rural communities, which you might even consider frontier, might have a dollar store that is for their grocery shopping. So we're asked to transport for, maybe to go to Costco, to a Walmart, to our individuals. The impact is also helping. We encourage entities to refer to us in hopes to help these seniors and adults with disabilities maintain their independence, avoid the long-term assisted living that is extremely costly. And so if we can help them maintain their independence and live at home, this is what we hope to do. We don't ask our drivers to just drive. We definitely don't want them to be what you would consider ride sharing, Uber, Lyft. Every driver we ask is to provide companionship. We want that driver to be a friend to our seniors. We may not in the office while we're taking the appointments or the requests, our phone calls might be 30 seconds to a minute. We ask our drivers to be that friend. All of our volunteers are mandatory reporters, and we want them to be able to get to know our clients, to help reduce that isolation and loneliness, to where our clients then feel comfortable letting them know if there's any problems that they're having. We want that friendship to foster within our driver and our clients as well. We know that our transportation, we know that all of our programs actually that we have are improving the quality of life of our seniors. We do an annual survey, and 96 in 2023, I'm sorry, 96% of those who've completed the service, it stated that RSVP is improving their quality of life. That's something that we really strive to do. And then we do have our transportation program is also used for critical emergencies as well. And I'll give you an example. We had a White Pine, which is Ely, Nevada, client get air flighted to a hospital in Utah. And after rehab, the hospital then calls us and says, is there any way that you can come and pick up the client one way back from St. George, Utah, back to White Pine County, Nevada? And so those are our critical emergency transportation that we provide. And this just gives you an idea of what we've done in 2023. And this, to me, I think speaks volumes about our nonprofit organization. So we drove a total of 338,613 miles. Our volunteers volunteered 47,269 hours. We were able to service 834 clients. That is not just transportation, that is our other programs as well. But it just gives you an idea of what a little small nonprofit is able to do with volunteerism. But this breaks down our miles, what we drove in personal vehicles and then in our fleet vehicle. So 148,080 miles were driven by our volunteers in their personal vehicles, and they get a mileage reimbursement. And 190,533 was driven in 2023 with our fleet vehicles. Gives you an idea of what our companionship program is. Here's an example of an RSVP volunteer going above and beyond. We had a 96-year-old client who is now 98, but she decided she wanted to try a portable oxygen concentrator instead of her heavy portable oxygen tank. After she received it, she couldn't figure out how it worked. So after our driver finished his day of driving, we have a couple drivers that will dedicate one full day in an area. And he went back then to her home to help her. He YouTubed it and was able to help her use her portable oxygen concentrator and taught her how to do so. That's the companionship that our drivers have. This isn't a unique situation. All of our drivers are extremely compassionate and about our clients. So just from January to August in 2024, we have serviced 543 clients in just transportation. Our transportation program is growing at a rate that I'm not going to deny it, we are having a hard time keeping up with. We're receiving a lot of referrals from hospitals, from social workers, from home health agencies. And I ask them why, why are they calling us? And it is because we are reliable. And so our volunteers, if a volunteer calls in sick, we ask staff then to take that ride. The last thing we want to do is have our clients have to cancel a critical medical appointment. So just from January to August, we have driven 170,612.1 miles with 100 active drivers throughout the state of Nevada. I give you an example of White Pine County because this is Ely, Nevada, and this is where we have the most miles. And I want to please take note that those miles are driven in our fleet by only 2 active drivers. They drive to the Salt Lake area, and I'll show you a map for those of you who may not know the distance. They drive to the Salt Lake area twice a week, St. George, Utah, maybe once a week, in Las Vegas 2 to 3 times a month. So just from January to August, they've driven 52,416 miles, which is actually, it's unbelievable to me, actually. And I couldn't be more thankful for them. They've provided 811 trips. So just to give you an idea where they go twice a week, they go from Ely to Salt Lake for critical specialty appointments. We have a lot of cataract appointments that we go to, dialysis. And the reason why we're called upon is because their county bus does not go across county lines. Their county bus actually doesn't even go on unpaved road. And in rural Nevada, we have a lot of gravel. So we do provide a lot of transportation to long distance destinations in our rural counties. Here's another example of Ely to Cedar City, Utah, 3 hours and 8 minutes one way. So that is a full day for our drivers. And then from Ely to Las Vegas, which is 3 hours and 40 minutes. Again, it is a full day trip. Our client, to become a client, it's 60 years or older, 18 to 59 years of age with verified disability. Here's another comment from one of our clients, because we do reassurance, we do assessment calls. So after a ride, we randomly select one of our clients to call and ask how, our service was for that day. And one of our clients said, Rodney was incredibly kind yesterday. He drove me to my doctor's appointment, and after the doctor instructed me to go to the ER, Rodney took me to the ER, and then after he finished the rest of his rides, he went back to the ER to check to make sure she was doing okay. I couldn't ask for anything more from our volunteers. But our volunteers, our drivers, they are definitely the heart of the program. There's mandatory reporters, so they need to report back to us of anything of concern. They're all background check. They get training for PASS if they would like the training to transport paratransit, which we encourage them all to do so. And then through our grantors, they also are asked to do the elder abuse and neglect as well. We ask, because of our AmeriCorps grant, the retired senior volunteer, that our volunteers are 55 and older. However, we will accept younger volunteers as well. We try not to go below 25 years of age. Our volunteers provide companionship. They do receive a mileage reimbursement when using their personal vehicle, and they receive lunch when transporting in our fleet vehicle. And that is through grants as well. And then we do volunteer recognition events annually. And then we try to send them gifts as well, just letting them know that without them, we would not have a program. So then how do we receive our transportation requests? So we used to do it in each individual field office. Now we have it all coming through our Carson City office. We've gone web-based. We've moved from a spreadsheet, an Excel spreadsheet, to a web-based platform. So a transportation client will call us. They will press 0. They will be asked, what county they're calling from, their name, the date and time of the appointment, the address of the appointment, the reason for the appointment, and that is all based on grant reporting that we need as well. And then if they need additional stop, we allow our clients to have 3 additional stops. So it could be medical, it could be shopping, it could go to the DMV office, the post office, the bank. And we do ask that the clients receive, in most areas, 1 request a week. In other areas, they can get up to 2 requests a week. And then the employees ensure that the request is within the county guidelines when taking that request. And then our requests go to our dispatcher. Our dispatcher then goes into our scheduling platform. She generates a report. She then confirms the driver's availability. We have a list of drivers, what days they're available, what times. Some only like Wednesday in the morning. Some will say Thursday afternoon is all that I can give you. We look at those then, and then the dispatcher will start dispatching those rides via email, text, or phone. Because a lot of our drivers are seniors as well. and they may not text, they may not email, they would prefer to get a phone call. And then the dispatcher assigns the request to the drivers. The dispatcher then updates the status in our platform. So if the dispatcher and the scheduler, if extension 0 is busy, we've then about a year ago got a new phone system that will then all of those phone calls go to a hunt group. So for example, yesterday I received 12 different phone transportation scheduling phone calls because it goes to a hunt group and all staff in the Carson City office is part of that hunt group. I've asked all staff to answer the phones because our clients do not like waiting and they don't necessarily like leaving voicemails. So we try very hard to address their phone calls the day of or within 24 hours if a message is taken. Just to give you an example, though, I think it was 3 Mondays ago, we reached we went over 100 phone calls in that day. And that is 5 of us answering the phone calls. So we are extremely busy. And then the driver, after it's been dispatched and assigned, the driver then is asked to call the client within, 24 hours before the appointment to confirm the pickup time. We ask for the appointment time and then the driver confirms the pickup time because the driver will then schedule their path. They'll go through and say, how are we going, who am I going to pick up first, second, and then drop off. We don't do that for the driver. We ask the driver to do that for themselves. All transportation requests are assigned to the driver 7 to 10 days before the appointment. What are our challenges? Our challenges, definitely are the long distance trips to essential services. That's why we have our guidelines. Our grantors have asked us to have guidelines. So we try to fill the van. We know, for example, in the Carson City area, we go to the Reno area, the more urban, every Thursday. For our Humboldt County, which is Winnemucca, I'm not sure if many of you are familiar with that area. We go to the Reno area on urban Tuesdays and Fridays, and then Elko on Thursdays. So, the larger areas on that end. Limited public transit options in our rural counties is really a challenge. Many of our county public transit options do not go cross county line. So that's where we're asked to pitch in. The cost of private transportation for our clients. One client transported from one rural county to a more urban. It was 45 miles one way, and it cost our client $175. Our clients, and our seniors cannot afford that. Lack of ride sharing and taxi services also are a challenge for our clients. And then infrequent and unreliable transportation services is a challenge as well. For us, a challenge on our vehicles in rural Nevada are repairs and maintenance. We, right now, currently with road construction, we seem to be replacing our windshields for fleets twice a month. Not for the same vehicle, but it just seems like we are twice a month. I'm being asked to replace a windshield for one of our fleet vehicles. Another, here's an example of driving on those gravel roads. Our vans are very low to the ground, and so you can see here where destruction happens as well in here from those the terrain of the roads that our clients live on and are being asked to. And you can see here's another one. It seems to be on the same for a lot of our vans. But we were extremely fortunate to sell that case to a grantor, our Nevada Department of Transportation. And in those rural communities, we are getting a SUV hybrid. And so we'll be able to use that. Unfortunately, we won't be able to transport paratransit that way, but as long as we have a paratransit vehicle available in that county, we were granted hybrid SUVs, and we needed those to get us through the winter months and through the gravel roads that our clients live on. Other challenges that we have as well, is our clients are really struggling with isolation and social disconnection, living alone. The physical and infrastructure barriers, limited emergency transportation, weather and environmental factors will, cause challenges come the winter months. Volunteer and service providers shortages. Everybody, is looking for volunteers. And it's hard to find volunteerism and volunteers that are willing to drive. And then our challenges are too, is our transportation guidelines and exceptions. You make an exception for one, word spreads, and now this exception is being asked, several times a week for several different clients. And so, that is a challenge that we are trying to overcome and actually try to find, solutions for those challenges. How do we address them? We would be nowhere without our grantors. Our partnership with our grantors, which, like I mentioned in our transportation program, is Nevada Department of Transportation and Nevada ADSD, which is Aging and Disability Division. We would be nowhere without our partnerships with them. Also with our local governments, we do receive a lot of support from our local governments as well. And our physician's office is something that previously we weren't really reaching out to our physician's offices, but now we are. We reach out, we ask them to help us with their scheduling. Is there a way that we could possibly schedule all of these clients from Elko going to Reno? We are requiring more detail when doing these scheduling because we do have to develop those partnerships and hopefully coordinate better scheduling for doctor's appointments. We're reaching out to more of our service organizations. We're giving them some help, and then we're asking for the same help, coming back as well. And then our hospital and care facilities. We're receiving a lot of referrals from our assisted living. They may provide transportation, but they cannot find drivers. So they're asking for our assistance, and then we're in return asking for assistance from them as well when it may come for fuel and repairs and maintenance funding. We are currently doing a volunteer recruitment campaign, in hopes to pull on the heartstrings of those in our community to provide transportation. And then we are, it should say, providing stipends to our drivers as well, because a lot of our drivers, like I mentioned, are seniors, and inflation has played a part in their monthly bills, and we're hoping to provide them then with stipends to encourage them to continue to drive so they don't have to go back into the workforce. And then we'll continue to seek additional fundings through vehicle donations and operating funds as well, because that's always going to be an issue. Our transportation guidelines has helped us with financial sustainability. It has kept us from, driving just one client to Utah, where now we know that, hey, we're going to Utah on these days. This is when you need to make your appointment with your doctor. And if you need help with your physicians, please call us and we'll try to advocate for that as well. Our drivers will go into the physician's office with our clients and ask that they, make their next appointment when we're available to drive them. And so this has helped us out quite a bit as well. But we work to ensure that our seniors and adults with disabilities have the transportation to access their needs. Our sustainability, how are we going to continue to do what we're doing? Well, we will continue to seek those grants, federal, state, and local. We'll continue to seek foundation grants. We are extremely fortunate with the foundation grants that we do receive. Donations, our donations has taken a hit in the last year, and that is because of inflation. I call the clients and ask, and it is because of inflation. One client gave us a very tear-jerking story saying that, Molly, I was able to donate $5 for every ride I received, which was once a week. She says, but that's 2 canned goods now. And Molly, I need to get my green beans. And so she is unable to donate her $5 to us. So we are seeking larger donations. We are trying to pull on the heartstrings of all of our businesses, and in hopes to, increase our donations that way. And then we do fundraise. So we have fundraising events, and we will just continue to try to grow those fundraising events. And at this time, do you have any questions?
Let's see. We'll start with the Q&A. Molly, from Heather, we are seeing an increase in requests for assistance with not only transportation to medical appointments, but a chaperone to assist with those appointments for day procedures involving anesthesia and sedation. I'm working on a medical chaperone pilot project, and we're at the beginning stages. And you mentioned that you do help with your volunteers will go into the medical office. Are they able to assist with these types of requests? And if so, how? How do they approach that? Is there a training? Is there's increase in insurance for you all, et cetera? Any information would be helpful.
Yes, so our volunteers are not able to sign them out when they are out on anesthesia. And so what we do then look for is if they can find a companion or a caregiver on that end. And I'll give you just an example. We have somebody in Frontier, Nevada, who needs to travel. And so we asked that she bring a neighbor with her. And she was able to get a neighbor. And so then that neighbor then becomes a client of ours and will stay with. So many times too, as well, is caseworkers will sign, the clients out, and then we will transport them with another volunteer of ours as well. But we are looking into, because at the AmeriCorps conference, there we were. I learned about the companion program as well, the medical companion. We're looking into it. However, it is an increase in an increase in our insurance, and so that is something that we're looking into. But right now, we either have the caseworker sign the client out, but we do not, or we'll ask the client to provide us with a caregiver or a companion of theirs, and that's how we transport them.
Great. How much do you, or can we ask you, how much do you reimburse for mileage? And do they have to file a 1099 form? Or is it not counted because it's technically not income, or is it because it's volunteer reimbursement? There were a couple of questions about that.
So we do through a state grant, through ADSD and FHN, we are able to reimburse our drivers 60 cents to the mile. We increased it. It was 45 cents, and we just had too many drivers say that they couldn't do it. So we asked for more grant funding, and we're able to get. So it is, I believe it is, it's a great reimbursement amount. And so if they pass that threshold, I believe of 3,000, they get the 1099, but many of our drivers don't do that. Our drivers that drive their personal vehicles will only really do the in-town. If they need to go long distance, that's when we encourage them to use the fleet, because then there's multiple people in that vehicle. It's more efficient that way as well. And so the personal vehicle driving is really just local.
Great. Let's see. This is a great question from Eric in Wisconsin. He asks, how do you deal with coordination with other organizations in your areas that do similar work? Are there county coordinating committees?
Yeah, so we know all of their guidelines. So, so for example, just in Winnemucca, I'll just give you an example of Winnemucca. Winnemucca's transportation is through their senior service. We are in complete communication with them. So they know when we drive long distance and locally, and we know when they do. So we never go on the same days. We do the same with, I believe, all of the counties, actually. We don't transport to the same location on the same day. And so if our client was to call and say, I can't change my appointment, before we put in for an exception, before our dispatcher will put in for an exception to transport on a day that we don't normally go, we will reach out to that county or to the other services and see whether or not they can transport that individual. If they cannot, because their bus might be full, then we'll put in for an exception. And if we can financially do it and have a driver to do it, then we will transport them on that day. We don't like to do it because then that means our fleet vehicle, is transporting one person. And so we try not to do that because it isn't really efficient. But yeah, so that's how we do it. We do a lot of calls to our partnering agencies, which takes a lot of time. And I'm trying to figure out a better way to do
Yes.
that, but I really just don't have that answer.
Yeah. I was going to say that, that seems like a lot of time spent coordinating. However, the
Mhm.
benefit, I would think most often would outweigh maybe,
Yeah.
that time spent. So I think that's wonderful that you do have those partnerships, because most oftentimes in rural areas, we don't have that. Um, I have a question about pass. Isn't pass training required for all NEMT drivers? But because you're volunteer drivers, is it not considered non-emergency medical transportation drivers?
So our volunteer drivers can tell us whether or not they will transport wheelchairs or not. And so we have like a list of drivers that will. So in our scheduling platform, it will have the individual's name, and in parentheses, it will say that this individual is in a wheelchair. And so then we dispatch those, individual rides to the drivers that have the past training.
Right.
Um, and then for us, we ran into a situation 2 years ago where the state didn't have anybody who was a trainer for PASS. So then that's where I stepped in and said, well, I'm going to kind of take control so we can train one driver tomorrow if we had one sign up. So I am a trainer for PASS, and then that gives us a little bit more flexibility, freedom, initiative, to where if I get a driver signing up today who's willing to do it, then I'll schedule the PASS training with them tomorrow.
Great. Do you provide supplemental insurance for your volunteers?
So the volunteers, if they're driving their personal vehicle, do have to have their own insurance. They're the first, and
Mhm.
then we would be the second.
Great. What
And
web-based programs I guess I'm assuming that this is a scheduling question. What web-based program do you use for
So
scheduling, maybe?
yeah, so currently we use Verizon Reveal. And we went that route because we were able to have GPS systems, through Verizon on that. We are looking at a different, because it's hard. It really wasn't, um, for all of our counties, we have to have separate logins. They weren't able to get all of us in one, where you could have a drop down. So when they call, you have to log into Humboldt. If somebody calls from Winnemucca or Elko, you have to have separate logins. So it isn't ideal. And so that's what I started looking into a different one. However, the one I'm looking into now doesn't have GPS. And I'm telling you, GPS is extremely important to have, because if a vehicle breaks down, we had a vehicle breakdown in the middle of nowhere. I was able to call that towing company, give them the longitude, latitude, and boom, they were able to find our vehicle. So Verizon Reveal, though, short answer is what we use currently.
How far in advance must your ride request be submitted?
Depending on the county. So Carson City, Douglas, and Lyon County are definitely our most busiest. So we ask for 7 days in advance. In our other counties, we ask for a minimum of 5. But we do next day. That would be an exception. And we will do that if we can find a driver. But we do keep notes to make sure that it's not the same client habitually calling, needing
Right.
the next day. What we try to enforce our clients is to let them know that we are not a taxi service.
Great. Another question, have you had any luck with financial support from healthcare providers and facilities since you help reduce no-shows and keep exam rooms filled?
Unfortunately, no. But I can be extremely persistent, and it doesn't mean that I'm going to stop asking.
Right,
But no,
right.
I will
Uh,
continue to ask.
it doesn't hurt to ask, right?
Right.
So a couple of questions regarding drivers. Is CPR first aid training a requirement for your volunteers?
No, it is not a requirement. However, though, it is something that we encourage.
And past training is required for all who drive the wheelchair accessible vehicles, correct?
Yes, yeah, most definitely that is. Because our policy when it comes to, like the CPR, and we ask our drivers, all of our companions, is, right away if something, stop, dial 911.
And outside of the mileage reimbursement and the free lunch that you provide your volunteers, do you provide any other incentives? I know you said that you do the recognition annually and you try to send them gifts. And I think that all of those, um, probably help with your volunteer retention. Is there anything else that outside of that that you do for them?
Melissa's here too, and she's in charge of our volunteers. T-shirts. We do give yeah, t-shirts.
It's really developing that relationship with our volunteers.
Right.
Most of our service coordinators in our field offices have a really good bond, and have fostered a good rapport with our volunteers. And so if we ask, they come. Um, Plus, they've developed a deeper connection with a lot of our clients. And so they don't hesitate when asked, just because we really search for those volunteers who have that service in the heart
Yeah.
and aren't out for anything else except to give back to their neighbor. And I think that's huge when it comes to looking for volunteers.
Right. Do you all coordinate with any of the Nevada tribes?
Um, I'd have to maybe one, and that was the help from a service coordinator, because she was, a member of the tribe as well. We've reached out. that we not necessarily have seen the need, or the need isn't coming to us. And
Okay.
the question that we've asked then is, is it something that they don't need us, or do we need to be more aggressive in
Mhm.
getting ourselves into the tribe?
Right.
Right. So it for us, we felt that the one that we did, that we were able to, we were not able to get in until one of our service coordinators joined us and was a member of the tribe.
Mhm.
And then some of our tribes are in our larger counties where we don't offer
Oh,
their
okay.
services. So they're not all rural areas. We do have services, in a few of them, and I think we've been invited in one of our newest counties where we just started transportation a few months ago. We've been invited to do a presentation. It just hasn't worked out yet.
But that service coordinator as well is Native American as well.
Mhm.
So, it kind of, you have to have that, what we have found that in, that relationship.
Right. One of the big questions that's I'm sure on everyone's mind is, do you have any recommendations on where to start if you're just starting a new program like this with, trying to recruit volunteers, find funding? I know you mentioned your grants and et cetera, of course, funding vehicles. Do you have any recommendations on a new start program?
Yeah. So, yes, I would definitely recommend going to your local dealership. And if there's a dealership that, is willing to donate a vehicle, and, make sure that you have the stories of the need behind it. And, that can be, every community has a need, that seniors are living alone with no family around, and they need to get to these medical appointments. What we found as well is sending emails is not effective. You need to be able to go to the doctor's offices. Most definitely find where and which doctors are seeing your seniors, and which grocery stores, and start there for the funding, asking them for fuel cards, asking, to start there. But if needing a vehicle, or even, I do have to say another thing that we do for our volunteers as well is we did get foundation grants to give our volunteers fuel card. And so we try to do that annually, if not twice a year. And as a thank you, we will, there's foundations that they don't want to give, just the dollar and say, here's $3,000, use as you want. They want to say, I want to know exactly where this is going. And we were able to give fuel cards. But I would start definitely with your service organizations for volunteerism. We were able to go to the Lions Club. We got some volunteer drivers from each of the community's Lions Clubs. We were able to go to the faith-based organizations and do presentations and get volunteers that way. And we were also able to get fuel money. But if looking for a vehicle that you want to start with, I would definitely encourage you to go to your local dealership and see if they wouldn't be able to donate a used vehicle.
Do you coordinate with any veteran services organizations?
Yeah, all of them.
Wonderful.
We do. And the reason being is they provide transportation as well. Many of our drivers are veterans. And so if that is one of our partnerships, is the VA hospitals throughout the area and in the Utah area, and in Vegas. We get calls saying, hey, we can't transport, can you transport? And then if we can't, we call them, letting them know as well that we can't. We know their schedules, and we definitely, we work with all of them.
Great.
Open communication is key.
Oh, absolutely.
Mhm.
Absolutely. And keep the visits going. Visit,
Yep.
visit, visit.
Yep, exactly.
You mentioned fuel cards. How much are those fuel cards that they receive?
They received, it was $50.
Great.
So they receive twice in a year, $50 fuel card. Yeah.
And do you require additional documentation from your volunteer drivers, such as copies of auto insurance and driver's license and things like that? Could you detail that a little bit?
Good.
Yes, so all of our drivers, not only driving our fleet, but also our personal vehicles, we need their DMV history for the past 3 years, their vehicle or insurance, and their driver's license.
Great. And one more question. Does your program ever refer individuals to other services such as Medicaid if they have, Medicaid transportation, public transit, paratransit when that's available, or other faith-based transportation volunteer programs in your area?
Yeah, so within all of the areas, the 15 rural counties, I'm not sure that there is a faith-based that does provide transportation. If we can't do it, we definitely refer over to the public transportation and they refer back to us as well. And then what was the first one? The referral?
Medicaid and EMT, if they're a Medicaid recipient, they have medical transportation benefits. Do
Right.
you kind of process through eligibility, ask that question through eligibility for your callers?
No, we don't. But MTM, which is Medicaid, they actually refer to us. They're having a hard time finding drivers in the rural communities. And so what they're asking their drivers is to drive from an urban area to a rural area, pick up the
Mhm.
client, bring them to their appointment and go back. So they've asked us if we could, maybe take on their clients and then they would give us the reimbursement on that end. Right now, we haven't ventured into that because I don't want to overcommit. Because like I said, we're receiving referrals from home health agencies, hospitals, um, and government, and we're having a hard time keeping up with what we have. Once I make that commitment, then because I have to tell you one thing we don't do, um, we very, very rarely cancel.
Right.
And I don't want to overcommit at this point.
And when you speak of lunch for your drivers, how does that work? Do you give them a gift card, a real meal, or a local restaurant gift?
So when they're driving, they have to drive. It's more than 4 hours in a consecutive day. They then go to lunch. There is a per diem. We go with the GSA rate per diem, and then they submit at the end of the month their receipt, and then we submit a reimbursement for that. And when they're driving, most of the time it is a drive-through because they'll have a car, a van full of clients, and so it's like a drive-through, type of situation.
Gotcha.
Mhm.
And then I think our last question for today is, do your drivers get paid from their home to drive, or do they just do they get paid for the first last mile, those unloaded miles, or is it just when they've got someone in the vehicle?
So it can be all of our offices where our fleets are located, which is our main office and then our field offices, is what we consider through AmeriCorps a volunteer station. And so then they can, from their home to the office to pick up the van, the fleet, they can get a 40 cents mileage reimbursement and home. But in all honesty, we don't have any drivers that look for that mileage reimbursement. Now, if they're driving their personal vehicle, it is from the start of their house, from their home to the client's home to the appointment and back again, which is that 60 cents mileage reimbursement if they're driving their personal vehicle.
Great. And And Molly, if you are open to getting other additional questions after the after this presentation, we had an attendee ask if we could get contact information for additional questions for you or someone in your organization. If you would just throw that in the chat, that'd be great. If not, that's going to be the end of our event for today. I think on your screen, you should see NADTC's contact information, our email and toll-free number. Our toll-free number is open Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time. And that is for our technical assistance service that we provide. Again, I invite you all to join our monthly newsletter. And again, it's great information. It's not terribly cumbersome. We won't fill up your mailbox every month. And thank you, Molly. We really appreciate it. Great information and best of luck on your service.
All right, thank you. And thank you for having me.